Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are talking about Oxcarbazepine, also known by the brand name Trileptal. Before we get started, remember that this education is for learning purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Please do not start, stop, or change any medication without speaking with your prescriber. Alright, let's talk about Oxcarbazepine. And don't worry, we are going to keep this simple. We are not here to turn sodium channels and sodium levels into a confusing family reunion. We are here to understand the medication in a way that patients, families, students, and providers can actually use. No unnecessary big words, no medication gymnastics, just clear education with a little fun. What is Oxcarbazepine? Oxcarbazepine is an anticonvulsant medication. It is also known by the brand name Trileptal. It is related to carbamazepine, but it is not exactly the same medication. In simple terms, Oxcarbazepine helps calm excessive electrical activity in the brain. Oxcarbazepine is like carbamazepine's cousin. They are related. They have some similar features, but they do not behave exactly the same at the family cookout. What is Oxcarbazepine used for? Oxcarbazepine is commonly used for partial seizures and seizure disorders. It may also be used off-label for bipolar disorder in selected patients, mood instability, irritability, or impulsivity in selected clinical situations. In psychiatry, Oxcarbazepine may be considered when a mood-stabilizing effect is desired, especially if another medication was not tolerated or not appropriate. However, patients should understand that its strongest FDA-approved role is seizure treatment. Psychiatric use may be off-label depending on the situation. A simple teaching line is, Oxcarbazepine is mainly a seizure medication, but it may be used off-label to help stabilize mood in selected patients. Mechanism of action, how Oxcarbazepine works in the brain. Let's go a little deeper, but still keep it simple. Brain cells communicate using electrical signals. Sodium channels help those electrical signals fire. When brain cells fire too much or too unpredictably, symptoms can worsen. Oxcarbazepine helps block voltage-sensitive sodium channels. Think of the brain like a room full of people texting at the same time. When the messages are organized, everything works fine. But when the messages become too chaotic, the system gets overwhelmed. Oxcarbazepine says, let's slow down the message traffic. It does not shut the brain down. It helps reduce excessive signaling. Oxcarbazepine may be used off-label for mood stabilization. It may help selected patients with mood swings, irritability, and impulsivity. But it is not always considered a first-line bipolar medication, compared with options such as lithium, valproate, or some antipsychotics. So the prescriber should be clear about why it is being chosen. The treatment plan should answer, what symptom are we targeting? How will we measure response? What side effects are we watching? What labs do we need? How will we follow up? A prescription without a plan is just hope in tablet form. Starting dose, titration, and maximum daily dose. Oxcarbazepine dosing depends on the diagnosis, age, kidney function, and tolerability. For adults with seizure disorders, a common starting dose may be 300 mg twice daily. Titration may increase gradually based on response. For psychiatric off-label use, dosing is individualized and often starts lower in sensitive patients. Do not rush the dose. If the patient is dizzy, sleepy, or unsteady, that is feedback. The body is giving a review. Listen to it. Labs and monitoring. Oxcarbazepine does not usually require blood level monitoring like some other medications, but labs still matter. Providers may monitor sodium levels, kidney function, and pregnancy status. Why sodium? Because Oxcarbazepine can cause hyponatremia. The sodium level matters. The sodium is not just seasoning, it is a serious lab value. Common side effects may include dizziness, sleepiness, fatigue, nausea, vomiting, and headache. Many side effects are dose-related. Double vision, blurred vision, and unsteady walking can also occur. Starting low and increasing gradually can help. Important safety warnings. Low sodium or hyponatremia. Oxcarbazepine can cause low sodium. Symptoms may include headache, confusion, nausea, vomiting, weakness, fatigue, and unsteady walking. Severe confusion can also happen. Older adults and patients taking diuretics may be at higher risk. If a patient becomes confused or weak, check the sodium. Serious skin reactions. Oxcarbazepine can rarely cause serious reactions like Stevens-Johnson syndrome. Patients should report rash right away. Urgent symptoms include fever, mouth sores, eye pain, skin pain, blisters, or peeling skin. Do not play rash detective at home. Call the provider. Allergic reactions. Patients allergic to carbamazepine may have a higher risk of reacting to oxcarbazepine. The body remembers. Birth control and pregnancy considerations. Oxcarbazepine can reduce the effectiveness of hormonal birth control. Discuss options with your provider. Do not let birth control effectiveness be an afterthought. Afterthoughts create surprises, and some surprises are medically complicated. Medication interactions. Oxcarbazepine has fewer interactions than carbamazepine, but they still matter. Tell your provider about all supplements and meds. Even medications you take sometimes can still matter. Be thorough with your history. What families should understand. Families can help watch for confusion, weakness, dizziness, rash, fever, or mouth sores. The goal is symptom improvement with safety, not just the patient is calmer. Stable and safe is the goal. Teaching points. Number 1. Oxcarbazepine is an anticonvulsant. Number 2. It works by calming excessive electrical firing. Number 3. Sodium monitoring matters. Number 4. Watch for symptoms of low sodium like confusion and weakness. Number 5. Watch for serious rash and report it right away. Number 6. Ask about carbamazepine allergy cross-reactivity. Number 7. Discuss birth control effectiveness. Number 8. Individualized dosing is key, often starting at 300 milligrams twice daily. Number 9. Do not stop suddenly. Number 10. Keep education simple so patients know what to expect and what to report. Let's bring it all together. Oxcarbazepine is an anticonvulsant used for seizures and sometimes mood stabilization. It works on sodium channels. Safety concerns include low sodium, rash, and birth control interactions. It is a tool that, when used carefully, can be very helpful. Thank you for watching. Again, my name is Dr. Ben Osevwe, DNP-PMHNP. Please subscribe to our YouTube channel for more educational videos. Join our mentorship family today at rotationmatchnetwork.com. For support, text 83299166516. I'll see you in the next one.